So at Riggs, we are doing something very specific with the testing that we're doing. We are looking at how we're trying to get a picture of somebody's internal world as best as we can. So we do that with a standardized battery that everybody is given when they are admitted. It's usually during the second or third week of their admission. And that battery includes a cognitive testing, commonly referred to as an IQ test. It's a WACE, a Wechsler test. We also give the Rorschach inkblot test and a test that's called the TAT, the thematic apperception test, as well as some tests of drawings called the human figure drawings. The report goes into all of the materials that are part of the evaluation or reevaluation and informs the therapist. It's a different perspective to give the therapist about how their patient is seeing the world, is processing information, is thinking, is handling feelings, and is also functioning cognitively. So then the therapist takes that data and integrates it with everything else that they know and hear of the patient in those case conferences. So they are doing a monumental task, really, trying to integrate information they know of the patient from the patient, information that the therapist and the patient learn together about the patient's history and their family history, the psychological testing, and just the various perspectives of people who have been working with the patient, different treatment team members. So the therapist takes the testing report as part of all of that data, brings it together, and hopefully it extends what they have begun to learn of the patient already. That's kind of when psych testing is done well, when it's familiar enough to both the therapist and the patient, and then extends things a bit deeper and offers different possibilities for ways to think about what's happening. And then from there, after the therapist has done this task of integrating and making sense of it all, they talk to their patients about it. And therapists do that in a number of different ways. Some integrate it into the feedback that they're going to give the patients after the case conference. Some people will go over the testing reports more directly. I think it really depends on how the therapist thinks the information that they have to give and really to converse with and to talk with the patient about is going to be best received by the patient. What would be the best way to talk with this person so that they can make sense of it and take it with them.